Hello friends, today I am telling about mumps. Mumps is a contagious viral infection that primarily affects the salivary glands, causing swelling and pain. Mumps are not common nowadays because of vaccines, but outbreaks do happen. Who will get mumps? The main risk factor for mumps is not being vaccinated against the virus. Mumps can affect individuals of any age, but it is most common in children between the ages of 5 and 15 years old who have not been vaccinated. In recent years, there has been a slight increase in mumps cases among adolescents and young adults, particularly in settings such as colleges, universities, and other close contact environments. Being in close contact with someone who has mumps, traveling to areas where mumps is more common, immunocompromised conditions, poor hygiene, living in close quarters and working in healthcare institutions are the other risk factors for mumps infection. What are the symptoms of mumps infection? Symptoms of mumps show up about 2 to 3 weeks after exposure to the virus. Some people may have no symptoms or very mild symptoms. Vaccinated people who get mumps usually have milder symptoms and fewer complications. The first symptoms may be similar to flu symptoms such as fever, headache, muscle aches or pain, not wanting to eat, tiredness. After few days, swelling of the one or both salivary glands starts. It is associated with pain or tenderness around the swelling. Sometimes, glands below the floor of the mouth may also swell. What is the treatment for mumps infection? There is no specific treatment for mumps infection. Most cases of mumps are mild and resolve on their own within a few weeks. Treatment typically focuses on relieving symptoms and includes plenty of rest will help body to fight the infection. Drinking plenty of fluids such as water or clear broth to stay hydrated, especially in case of fever. Over-the-counter pain relievers such as acetaminophen or ibuprofen can help reduce fever and relieve pain and discomfort. Applying warm or cold compresses to swollen glands can help alleviate pain and swelling. Eating soft, easy-to-chew foods can help ease discomfort if swollen glands. Antibiotics are not effective against viral infections like mumps, but they may be prescribed if a bacterial infection develops as a complication of mumps, such as bacterial meningitis. What precautions can be taken against mumps? Ensure you and your family members are up to date on the MMR, measles, mumps, and rubella vaccine. This vaccine is highly effective in preventing mumps. Both children and adults can receive the MMR vaccine. It is typically administered in 2 doses in children at 9th month and 18th month. 1. Wash your hands frequently with soap and water for at least 20 seconds, especially after coughing, sneezing, using the bathroom, or touching surfaces in public areas. If soap and water are not available, use hand sanitizer with at least 60% alcohol. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze, and dispose of tissues properly. Avoid coughing or sneezing into your hands to prevent spreading the virus. Stay home from school or work and avoid close contact with others to prevent spreading the virus to others. Taking these precautions can help reduce the risk of contracting mumps and prevent its spread to others in your community. If you like this video, support us by subscribing our channel. Thank you. Namaste.